In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk almost not at all. So we do not advise that.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
People tend to leave them on. They contaminate the face mask and then wipe it over something. So it's really not a good idea and doesn't help.
There is no evidence that general wearing of face masks by the public who are well affects the spread of the disease in our society.
The evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it.
When the evidence around the use of masks by the general public, especially outdoors, is extremely weak.
The recommendation from SAGE is completely clear, which is that there is weak evidence of a small effect in which a face mask can prevent a source of infection going from somebody who is infected to the people around them.
There was a statement by the World Health Organization, which was definitely against the wearing of muzzles. A few weeks ago, the World Health Organization did a reverse ferret and changed its mind. And Deborah Cohen of the medical correspondent Newsnight on the BBC had an amazing scoop the other day. She actually discovered, and she put it to the WHO, that her contacts inside the World Health Organization had told her that the position of the WHO on muzzles had been changed because of political pressure, not because of medical reasons.
Newsnight understands that the World Health Organization committee that reviewed the evidence for the use of face coverings in public didn't back them. But after political lobbying, the WHO now recommends them.
Of the coronavirus, many people have been running to the store to buy face masks similar to this one to protect themselves.
Medical masks like this one cannot protect against the new coronavirus when used alone.
Masks are really not necessary and they may actually be unhelpful.
WHO only recommends the use of masks in specific cases.
And if you're not sick, you shouldn't be wearing a medical mask, but if you are, then you should.
People who are sick wear a mask. We recommend that people who are around someone who's COVID positive wear a mask, but do not recommend that the general public wears masks as a protective mechanism.
If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough.
These face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control. These actually, we have clear scientific evidence, they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine.
Should you wear a mask if you're healthy?
No.
Should you wear a mask if you're healthy?
No.